Welcome to our 5 on 5. I'm pleased to be joined today by the new Oregon Health Authority Director, Dr. Sejal Hathi. Good to see you. Thank you so much for coming in.
Thank you for having me.
So you've spent a couple of years with the White House as a public health advisor and several months with the New Jersey Health Department. What made you want to come to this position in Oregon?
Well, thanks for the question. I always appreciate and revel in the opportunity to celebrate all things Oregon. I have had my eye on the state of Oregon and particularly the Oregon Health Authority for years now. This is a state that has long been at the forefront of groundbreaking health policy, especially to serve those communities that have been historically marginalized and ignored. And I wanted to be part of that tradition. I wanted to be a part of the team that operationalize this groundbreaking 1115 Medicaid waiver to leverage Medicaid dollars to address upstream determinants of health. I wanted to be part of the team that was the first to liberate psilocybin services in the way that we have. I wanted to be part of the team that was among the first states to take advantage of federal dollars for CCBHC, Certified Community Behavioral Health Clinics. Time and again, Oregon has proven that it not only has the willingness but the hunger to meet otherwise intractable challenges with grit, with imagination, and with creativity. And that is the type of team that I wanted to join, and the tradition of boldness that I wanted to be a part of.
And you're visiting different parts of the region, visiting Southern Oregon, of course, right now as we're speaking with you. Who are you meeting with, I should ask?
I am meeting with both local leaders, community leaders, providers, payers, members of the burn networks, local mental health authorities, local public health authorities, CCOs, and their community advisory councils, and members of the broader community that have been disproportionately harmed by the health inequities that we seek to rectify and as an agency address. And the intention behind this listening tour is to ensure that early as I am in my tenure, the vision that I set, the priorities that I articulate are informed by and anchored in the lived experiences and the real challenges, needs, and priorities of communities just like this one on the ground, who have been doing the work, who have been living the problems that we seek to address day in and day out.
Okay, very good. We're going to take a quick commercial break. We'll have much more in just a moment. Okay. Stay with us. Welcome back to our 5 on 5. Again, we're here with the new director of the Oregon Health Authority, Dr. Sejal Hathi. We talked a lot about a little bit about what you're doing around the state, but have to ask you about 110. Obviously, it's something that everyone's talking about, and you're stepping into and learning about, I'm sure. The rollout hasn't been easy. The legislature's literally talking about making major changes as we speak. What is the OHA's role with 110 right now, at least?
Well, I'll tell you my role, and that is as a doctor, as a public servant, as a public health practitioner. It's to ensure that the people who need services most, the people that Measure 110 was passed to help and to serve, for them, we meet them where they are, and we provide them the harm reduction services, peer support services, housing rehabilitation, and treatment services that they need and deserve. That is my priority, to ensure that no matter what reforms the legislature passes, and whatever they are, my job is to execute them. But my hope, my desire, my ambition is to ensure that those treatment dollars are preserved and expanded. And really that is our mission as the Oregon Health Authority as well, to spend those treatment dollars effectively, transparently, and with accountability so that they reach those most in need.
Doing a little research, I came upon your priorities, access to care being one of them. Of course, that's hugely important here in rural Oregon. What can the OHA do to help people get better care or be closer to their care?
Yeah, well, a core pillar of access, of course, is workforce. And one of the challenges that I've heard repeatedly in even my short time here in Southern Oregon is that we simply don't have enough providers, from primary care providers to peer specialists to therapists to psychiatrists. We are not building, recruiting, and retaining the pipeline of providers that we need to serve the people who are demanding care. And as an agency, as a state, we have recognized this. The legislature has already doubled down on addressing this problem by liberating tons of dollars to support scholarships and loan repayment programs for providers. We've increased Medicaid reimbursement for these providers. So they have a further incentive and capacity to treat Oregon Health Plan members. But really, this is just the beginning. And so one of my goals over the next several months will be to determine what are those other levers that we can deploy at the state health agency level to build that pipeline and support their broader capacity to deliver necessary care.
Yeah, it's certainly a busy time for you right now. We certainly appreciate you taking the time. Great to meet you.
Thank you.
All right, stay with us. We'll be right back.